we talk about mesh, usually I like to let my patients feel and see what mesh feels like. And there are many different types of mesh on the market. There are both thicker and lighter weight meshes. There are meshes with and without color. I have two samples of mesh here that I often let my patients feel. So a blue one and a clear one. And one of the reasons I like to show this is that when there are complications with mesh and we talk about taking it out, it is very hard to cut something that is clear, that is stuck between my fingers and my body grows throughout without injuring you, and get every piece of it. So while I often joke that I like the blue mesh, it's not because the color is blue, but because if there is a complication or there is a problem, it's a little easier to take it out. It does not mean that I always use a blue mesh. I try to fit the right surgery to the right patient. Prefer not to use mesh, but there are times where mesh is appropriate. One of the more traditional surgeries that's been around since the late 50s is something called a sacrocolpoplexion. It's a really big word for a big GYN surgery. But in essence, what we do is we take the vagina that is prolapsed and we put a piece of mesh on the front and the back of it and then anchor that to the spine. We anchor it to the ligament of the spine called the anterior longitudinal ligament. Classically, it's done through a large incision. We do it through laparoscopic incisions, smaller incisions, faster recovery, less pain. Often, to aid in this surgery, many of us will use the Da Vinci robotic system. And unfortunately for us surgeons, it's not like George Jetson where we hit a button and the robot does the surgery for us. What it does is it lets us use very precise instruments in your body while our hands are outside your body, and when we turn our hand, the instrument in your body turns the way our hand does, so that we can do surgery with lots of sewing or other procedures, highly technical surgeries, laparoscopically, speeding your recovery and speeding your return back to normal life.